My name is Tiffany Poss, and this is my public service announcement on maternal mortality in the United States. Maternal mortality can be defined as death that occurs during pregnancy or within the first year following delivery. Current data suggests that 45% of total maternal mortality occurs during the first 42 days postpartum. The United States is considered a powerhouse, technologically advanced and fully capable of providing the best healthcare in the world, and yet maternal health in this country is in a current state of crisis. Mortality rates indicate a 50% increase from 1990 to 2013. The national pregnancy-related mortality ratio in 2014 stated 22 deaths per 100,000 live births, with 60% of those as preventable deaths. Non-Hispanic Black women have an increased risk of maternal morbidity and mortality. The PRMR was found to be 42.8 deaths per 100,000 live births, nearly double the amount compared to the national average. Causes of maternal mortality include cardiac conditions, which account for more than 33% of pregnancy-related deaths, followed by non-cardiac conditions, infection, and obstetric hemorrhage. Black women face significant health disparities across their lifespan, especially during the reproductive years. Research indicates that Black women experience 50% more unintended pregnancies. They have nearly 4 times the rate of abortions, with a higher percentage of those occurring during the second trimester. Black women are also 3 times more likely to die from a pregnancy-related death. They have a higher preterm birth rate, and they're less likely to be offered genetic testing. So the question remains, how can providers make a difference and help decrease the incidence of maternal mortality among Black women? With over 700 women dying annually in the U.S. from pregnancy-related causes, it's time to examine current preconception, antenatal, and postpartum care to identify ways that healthcare providers can change practice methods and incorporate ones that positively impact maternal health. Maternal mortality review committees are essential in the evaluation and prevention of maternal morbidity and mortality. They released a report that studied multiple factors that contributed to pregnancy-related death. And while there was no single intervention to alleviate current trends, they stated it was imperative to investigate each maternal death to advance women's health, reduce social injustices, and safeguard quality care for pregnant and postpartum women. Providers play a critical role in reducing the rate of maternal mortality in the United States. They can take initiative and recognize women at increased risk of maternal complications, starting with adequate preconception care and ending with close postpartum follow-up. Every practitioner should be attentive, active listeners and focus on ways to extend care beyond the office and out into the community to promote better maternal health. The 12 weeks following delivery should be considered the 4th trimester, in which patients can receive careful follow-up with thorough screening for risk factors contributing to maternal morbidity and mortality. In fact, the American College of Obstetricians and Gynecologists now recommends that postpartum visits start at 3 weeks versus the traditional 6-week postpartum visit. Well newborn visits with family care providers also provides an opportunity to check in with parents and screen for housing instability, food insecurity, community violence, intimate partner violence, firearm access, financial insecurity, and social isolation. The Council on Patient Safety in Women's Healthcare published a set of guidelines to assist practitioners in reducing peripartum racial and ethnic disparities. Providers should establish systems for patients to accurately document and self-identify race, ethnicity, and primary language. Staff should be educated on implicit bias. They should be knowledgeable about peripartum racial and ethnic disparities, and they should engage in shared decision-making. Staff should also address family planning at every patient encounter and deliver discharge instructions that are clear and concise. Why do maternal health statistics continue to be poor, despite a plethora of guidelines for practitioners to follow, passage of the Affordable Care Act, and maternal health listed as an objective of Healthy People 2020? Despite ways to reduce healthcare disparities among Black women, they continue to face a number of challenges, including race-based discrimination while seeking family planning methods, research indicates only 59% receive prenatal care prior to giving birth. And Black women typically receive poor counseling in regards to smoking cessation and alcohol usage during pregnancy. Despite best efforts at eliminating health disparities within the United States, Black women continue to face multiple factors that contribute to poor reproductive health, including poverty, low education, unemployment, violence, and inadequate access to health care. 3 ways to offset the challenges faced by Black women today include use of the Pregnancy Risk Assessment Monitoring System, promotion and education amongst practitioners and patients alike regarding the 4th trimester, and use of local programs including community-based prenatal programs, breastfeeding support groups, and visiting nurse programs. In conclusion, statistics indicate women of all races in the United States are at increased risk of maternal morbidity and mortality. However, racial and ethnic disparities contribute to alarming rates among Black women. It's time for practitioners to take a stand, eliminate racism in clinical practice, and refocus our efforts on decreasing maternal mortality among women in the U.S.